Dr. Ogan Gurel, welcome to Weird Sauce, and thank you for welcoming us from your location, I believe, in Canada.
Yeah, thank you very much, Dr. Jennings.
Please introduce yourself to the audience for the very vast achievements that you've already have.
Well, thank you very much. It's a pleasure to be here. Great to see you. We've met several times during my various trips to Singapore. As you know, I was in Asia for about 10 years. So basically, I'm a doctor by background, trained in medicine, but I've been involved in many aspects of business, science, academia, and my career is fairly diverse. But I think the unifying theme is innovation in general and healthcare innovation in particular. So that's a nutshell of my background. If we can dive into particulars as you wish.
Sure. So I think, given the state that we've been in, and by we I mean the world for the past 2 years, a big pandemic, and then various changes that have happened, it would be probably very interesting to hear from you what has been the relevance, given your background in medicine and also in technology, of understanding basically the state of population health in different places. So you said you were in Asia for a while, for a long time. I'm also based in Asia, but I travel a lot. So I can see that different countries with the status of the health of their population have been responded and impacted somewhat differently with the given pandemic, and that depended obviously on age of the population, their metabolic status, general health, etc. So could we start by talking perhaps about this concept of, for the Western population versus Asian population, do you think that the lifestyle behavior that we have, which by this I mean what we repeat every 24 hours a day, so sleep, eat, move. I won't even say physical exercise, I'll say it's just move, right? So mobility, sleep, circadian rhythm in general, and nutrition. Do you think that these things have been woefully ignored to the point where during this pandemic, the status of those things and their impact on people's health actually came up and became something that we should really look into, not just during the pandemic, but certainly the urgency of looking at that later on. And that's what I mean by lifestyle medicine. And so what's your perspective, considering that you have a Western and an Asian data points on those things?
Yeah, like yourself, I've been around the world. Obviously, I was educated in the United States. I've worked in Europe. And of course, as I mentioned, I've been in Asia. So I've seen different healthcare systems and so forth. And when you mention about the outcomes relevant to COVID, there's so many factors involved. There's genetics, there's biology, there's the lifestyle medicines. You mentioned the actual medical systems, and there's vaccine responses. So I think it's very difficult to generalize. Even within Asia, you have examples of Philippines, Indonesia, Singapore, and so forth. Singapore is doing great, and then they're doing bad. It's like very difficult to predict. So, but that being said, I think there's something very interesting uncovered about what you describe as lifestyle medicine and the intersection with COVID. So in order to frame this, let's put COVID aside for a moment and talk a little bit about this concept of lifestyle medicine. And I know that phrase has been around, but what I like to call it is wellness. And I'll tell you why I call it wellness, not to be picky about definitions, but I distinguish wellness from medicine. And why is that important? Because in the current paradigm, which is changing, by the way, and I'll talk about how COVID is relevant to this. In the current paradigm, people are either sick or they're not sick. They go to the medical system or they don't go to the medical system. And that may seem obvious, but that's very much built into how medicine works in the Western world and in much of Asia, to the extent that for example, you have prescription drugs, and then you have over-the-counter. You have you check into the doctor, inpatient or outpatient, or you're at home. The insurance company reimburses it because it's medical, or they don't reimburse it. The regulatory authorities will regulate it because it's medical, or it's not medical, it's wellness. So there's a very sharp divide that is propagated in the financing, in the regulation, in the structure of the industry, and ultimately in people's behaviors. So we talk in terms of health policy about prevention and lifestyle management, as you put it, or wellness. But the institutional and societal structures are not designed around that. They still have that sharp divide. Now, of course, I'm simplifying. That divide is actually blurring. Digital healthcare, wearables, telemedicine, getting healthcare in your home. So that's changing, to be sure. So in other words, lifestyle medicine, as you put it, and the reason I changed the definition is lifestyle medicine includes the word medicine, but I want to distinguish those. So wellness and medicine. You can't see my hands on the screen, but I'll put them here. Wellness and medicine being separate. But wellness is like lifestyle medicine. So that's very separate. Now let's bring COVID into the equation. COVID is very interesting because it is a disease. And of course, some people are serious and some are not. And the serious ones can be very bad and obviously fatal. And what's interesting about COVID is that certain lifestyle aspects, such as obesity, long-term heart disease, hypertension, etc., figure as risk factors for severe disease. Now, this is very important because somebody with hypertension does not die in a couple weeks from hypertension. Now, of course, there's fulminant hypertension where they might get a stroke and whatnot. We're not talking about that. We're talking about, basically garden variety hypertension. People will live for years with that, but it needs to be managed, and they can get very serious consequences, kidney failure, recurrent strokes, and so forth over time, and they will have a shortened lifespan, but they will not die in 2 weeks. What that means is that it's a kind of lifestyle-related preventative medicine. It falls over into that area which is not compensated or not reimbursed. It's not regulated. And I'm simplifying again, obviously. But the point is, it doesn't become as urgent. Same thing with obesity. People don't die in 2 weeks from obesity. They may have diabetes. They may have orthopedic problems. Whatever it takes over time, it impacts their health, but not immediately. But bring COVID into the equation. These long-term lifestyle situations, for lack of a better term, become acutely dangerous. If you're obese and you get COVID, you could die in 2 weeks, morbidly obese. If you have, hypertension, you get COVID, you could die in 2 weeks. Now that's a very different equation. So I think COVID is going to gradually accelerate this blurring between the lifestyle medicines, you put it, or wellness, and the medical. It's a very difficult equation because societies, as I said at the outset, are structured with a very strict divide between the two. It's unclear, how that's going to change. I have some ideas, but it has to change. And I think COVID, to put a silver lining on it, will accelerate that merging.
So the one thing that I really would like to hear from you on how do you think this is going to change is the example of what we're seeing. At least I can say that for France. So the healthcare system in France, obviously a lot of the explanation around why people suffering from COVID cannot be all going at A&E at the same time is because we don't have quote capacity.
Right.
We don't have beds, and it's not the beds we're lacking; it's the people attending the beds, primarily physician and nurses and physician assistant and all the actual human factor in that. So it so happens that in the course of the past, it seems 10 years in France, the number of beds, quote unquote, in each of these public hospitals has been diminished and shut down. And there's been very little effort to pay people well, and there's been little effort to recruit to keep those people there. So that's the example of the French healthcare system prior to COVID. And every year we were told that the flu was a big challenge and that certain spike into these management of volume people, even if the volume changed only by a small amount, considering the size of the population in France, it was a big challenge. So compare and contrast that to healthcare system that you've known in the US and in Asia? And are they better prepared for this transition that you talked about? And depending on how you will explain that, then we can talk about how technology can advance this or
Sure.
perhaps clubber it, depending on how it goes.
Well, it's interesting. This phenomena that I mentioned of moving towards lifestyle medicine or wellness, which means that more care is delivered outside the hospital before preventative medicine, whatever you want to call it, does have the unintended consequence, whether it's the real reason or it's other budgetary priorities or whatever, of reducing hospital capacity, by logic. So if you have less hospital use, then you're going to reduce that. So the challenge there, of course, is when you have surge issues, such as with the COVID pandemic or other pandemic, things become limited. So I think that's a key issue, how to accommodate that. Now, in the United States, there's also been surge issues. I mean, ICU beds and ICU personnel, as you put it, are not easy to obviously just ramp up and turn on, such as in other industries. And I think the same here in Canada, where I am now. I think we see that in Korea, where I was. I think that's just the universal. I don't think it's specific to France. And to some extent, I don't want to say you have to have harsh medicine, but to encourage this shift away from acute care and more towards preventative care, you do have to put some pressure on the system and take away those resources that, one of the reasons why acute care is, especially in the United States, is so much and emphasized compared to preventative care is there's a lot of money in it. If you do an operation, you get a lot more money than if you, dispense exercise advice. So that's a big issue around the world, not just France. I don't have any easy answers, but I think part of the problem is if you, well, I do have an answer, let's put it that way. If you do these cutbacks on the acute care, but that don't properly support the preventative care so that people end up in the acute care, that's not good. So the question then is, how do we optimize? How do we really make that preventative care work so that we are indeed reducing the COVID deaths because there's not as much obesity, there's not, hypertension is well managed and so forth, or other things. I think then that's the central question. How do we really make that preventative care work? I do have some ideas, and I'll pass it over to you, Florence.
Yeah, so I think that there's two issues that are very interesting. I think the mechanistic issue, which is why this is happening, which we can leave behind because it's a mixture, as you said, of political, financial, and very complicated things to which I certainly have no expertise on. But what I'm very interesting is this shift that you've mentioned, the shift from, for whatever reason it happens, so we'll leave that on the side for now. But if it was to happen for reasons that are related to a must, a need for decluttering hospital, we don't have enough physician, whatever. So if that was to happen, how can we envisage that it will happen in a way where the individual, as in the patient, is meant to have responsibility, but is not meant to suffer a very deleterious collapse of his or her own rights due to the fact that now it's your responsibility if you're sick. And for this, I will quote, again, I will give the example of France. Our prime minister came out, I think, a month ago and declared that the best way not to exhaust the hospital is simply not to get sick. And that's the responsibility of everybody. So how can we manage this in a manner where the patient is not the loser, where you become just a wallet?
That's right.
You have no quality of care. You left in your home, just like what happened with COVID-19, where a lot of physician and healthcare systems send their patient home and said, come back when you can't breathe. Wait, they didn't say that, but
yes,
it amounted to that.
So I think there is a big missing factor in all of this. So Let's look at preventative medicine, wellness, lifestyle medicine, whatever you want to call it. But I like to call it wellness regime, whatever. So let's look at the wellness world. What does that entail? Well, there's been a lot of technologies, wearables, AI, apps, telemedicine, etc., that are related to tracking your steps, tracking your diet, tracking your weight, making databases, whatever. Everyone knows what I'm talking about. A lot of technologies around that. Silicon Valley drives a lot of this and so forth. But I think there's one missing factor. And the missing factor is education. Nobody's talking about that. Except me, or no, I mean, I'm not the only one, but I will explain why, what I mean. So I'll give you an example personally. So I'm a doctor by training, and I think, everybody has some health issues, so I have a few health issues here and there, but I know what's going on, I anticipate, and I'm in pretty good health, and same for my family. Because I have medical knowledge, medical training, I've kept up to date, as I mentioned. And, when you tell someone difficulty breathing, of course, people have an idea of that, but there's various, manifestations of dyspnea, which is a technical term for difficulty breathing. And to be aware of those subtleties and those different manifestations. So if you have no knowledge of medicine and healthcare, and it's just a black box, we have two problems. One is you don't really are able to take care of yourself. You have all these gadgets and all this AI and everything, but if you fundamentally, as the patient, don't know what's going on, you're not going to be able to do anything about it. The second problem with this is then you are susceptible to disinformation. So we know all about that, and so it's very easy for someone to say, well, vaccines are going to program your brain, so you are going to be a tool for Bill Gates. I mean, all sorts of nonsense. Okay? And I'm not saying, one should be healthfully critical of things, and this is not about just blindly accepting, whatever people say, but at the same rate, it doesn't mean completely being vulnerable to nonsense. So I think that a key missing element is education. Now, I don't know about health education. I remember when I was in junior high school, we had some health education. I don't know what the state of that is now. I do know what I'm doing. As you may know, Florence, I give a mini MD course, and I'm fairly passionate about it, even though it's a side project of mine. And people wonder, why is he so passionate about this mini MD course? Mini MD course, just for your listeners, is and I'm not doing this as a pitch for the course, but I think it's very relevant to what we're talking about, is a comprehensive 20-hour overview of all of medicine for healthcare professionals who are not otherwise medically trained. So healthcare lawyers, healthcare consultants, executives, biomedical scientists, etc. I've taught it for 10 years now. One of my goals for this is how can we make this mini MD, it's pretty intense, pretty high level, etc. But how can we make a version for the general public that everyone has a basic knowledge of medicine and how it works? That's missing. So one of the reasons I'm passionate about this and why I'm teaching this is I do feel that all this digital healthcare and everything is not going to work if people don't have some basic knowledge. So that's, I think, very important. And I don't know if the mini medical school or the mini MD is a solution to that. It obviously needs to be modified, but that's one way that I'm trying to contribute to that, the gap.
Well, I think that's essential. I mean, it's such a huge piece.
But nobody's talking about that. I mean,
no, you're right.
Right?
You're right. Yeah.
They're just doing the gadgets and everything.
Yes, particularly so, I would say, for the general public.
Yes, that's what I
You
mean.
do start seeing, people are saying people should be trained in nutrition. We've spoken on this podcast to a number of young doctors who just graduated and who said, my God, I came out and I didn't know anything about nutrition.
Right.
And I don't mean by this like which diet works, but rather really, biochemistry, the nutrition, effectively the impact of food onto bodies on a measurable and evidence-based level. And the relevance of this, because people eat multiple times a day. So if this was a molecule, if it was a drug, we would definitely study that. And it's a multitude of drugs that you ingest and that you're exposed to as a result of the food system, whatever habits you've got, circadian disorder, your own genetic, blah blah blah. And yet it's completely left behind. So imagine that. I mean, I don't need to ask you to imagine, it. That's for the professionals. So then now we go down, as you pointed out so rightly, to the general population. And you sit back and you go, oh my goodness, in a time of a real challenge where loads of information, good or bad, is being thrown at people on an hourly basis about this pandemic, for example, virology, antibodies level, blah, furin sites, genetic, phylogenetic of viruses, what is a coronavirus? Does it mutate? Does it not mutate? Variants, blah, blah. They have to get this information and then they have to make sense of it and then they have to then make a decision. How is this even plausible that this will happen in a population that doesn't even have basis understanding,
Yes,
or
that's
at
right.
least a good chunk of what needs to happen?
I'll give you an example. So I knew from the very beginning of COVID that there would be a lot of variants. Now, does that make me a genius or another Anthony Fauci? No. I had some basic knowledge about virology. Very basic. I'm not talking about being an expert or whatever. What did I know? What was the key fact that I was aware of that allowed me to make that prediction? And I said this, I'm not saying this in retrospect. I actually, as you know, have given podcasts and news, TV reports, whatever. I was interviewed on COVID, and so it's there. And I said there's going to be mutations. Why did I say that? Well, because there are two types of viruses. There are DNA viruses and there are RNA viruses. Of course, we knew from the beginning that COVID, SARS-CoV-2, was an RNA virus. And RNA is much more mutable than DNA. Polio virus and smallpox are DNA viruses. So they were more stable. We could get the vaccines and we didn't have to deal with a lot of variants, provided we did it reasonably well. Whereas we don't have that luxury with COVID. I knew that from the beginning. But it was just based on my understanding that it was an RNA virus versus a DNA virus that had all sorts of implications. So I don't think, people have to be incredibly knowledgeable. We don't have to be walking Anthony Fauci, etc. We don't have to take the full mini MD, but just a few basic concepts. How does symptoms work? How does the basic biology work? What's the difference between DNA and RNA, and the basic implications of that are really powerful. And there are two very important concepts. One comes from the Enlightenment, Sir Francis Bacon, knowledge is power. The other one comes from medicine. There is a therapeutic value to knowing what's going on. Even if, you may have a terminal diagnosis, but you kind of know. And you know what's going on. You can handle it. You can plan your life. Everybody ultimately dies. I don't want to put a damper on our discussion, but I think you know what I mean. But if we have knowledge about what's going on, if we can control in some way and manage the emotional aspect that's related to that, so it's not uncertain, and the uncertainty is damaging psychologically, mentally. Doctors know that. Good doctors know that. We are taught that. So if we have some knowledge, that has therapeutic value as well as practical value. So I think that's really missing. And it doesn't have to be, as I mentioned, tremendously detailed or complex knowledge, just some basic knowledge. And again, I don't know the details of health education in junior high schools and elementary schools around the world, but from what I see, what people are saying, general public as well as some professionals, there's a lot of lack of knowledge out there when it comes to basic medicine. I do want to add one point relative to this. I do think to some extent the medical profession is responsible for this. Not all doctors, of course, but I think traditionally doctors have kind of wanted this knowledge to be within their own guild, if you will, like the medieval guilds. If you read the Hippocratic Oath, for example, which technically is not a law, but most doctors know about this. First, do no harm, primum non nocere, the Hippocratic Oath. There's actually a line in the Hippocratic Oath that says, I shall keep all this secret and not tell anybody outside my profession.
Interesting.
So it's a kind of cultural thing. And obviously, there are doctors that are sharing knowledge and trying to democratize the process. But I think to some extent we keep it as a black box. And I think there's some good reasons for that because, as they say, a little knowledge can be bad. And as these are very complex things. And truly, medicine, even 4 years of medical education, 6 years, doesn't teach you everything. And so certainly, for example, mini MD 20 hours. But I do believe knowledge is power. I do believe some knowledge, even if it's not complete, it can never be complete, is therapeutic. So if we can find some way to democratize that knowledge, bring it out, all this telemedicine, all this home care, all this wellness, I think will make a lot more sense. It'll ultimately be easier for doctors as well.
Yeah, I mean, I would really concur with this this big if that you put there. If we manage to fix this gap, and that gap is huge at the population level
That's right.
because you're really looking at a field that has not stopped moving. So medicine is moving, technology is moving. So it's trying to catch a train that is going at its own speed. That's a really big effort if you haven't even got a clue that the train was moving.
But the fundamentals are some of these fundamentals that I present in the mini MD, for example, will not change. I talk about medicine from 1,000 years ago. You might say, well, that's ridiculous. No, I'm talking about, the difference between diagnosis and treatment and prognosis. Hippocrates outlined those. We still use those terms. What does it mean to have an acute disease, a chronic disease? Again, these are 1,000-year-old concepts. What's the difference between symptoms and signs? And vital signs. These are long-term concepts. Again, DNA versus RNA, which I mentioned, which is central to our understanding now, is something that was known for the last 50, 60 years or more. So obviously there's new stuff, and you're right. It's very interesting that you mentioned that. When I'm updating the mini MD, there's always these changes, and I actually update it every year. But at the same rate, there are some long-lasting concepts, and I'm actually planning a kind of summary, even more tighter summary, which I call the laws of medicine. I have 7 laws of medicine. The 0th law of medicine, kind of like thermodynamics, the 1st law, 2nd law, 3rd law, etc. We don't have time to go through that now, but I do think there are some recurring, long-lasting themes that should be transmitted, and not just a bunch of facts, which change. So, for example, this is very interesting. It relates to another research interest of mine related to epistemology and knowledge. What are the core elements that are unchanging? When I choose to teach in 20 hours the mini MD, what are those concepts that I choose to present? Because those should be more long-lasting. So let's look at, for example, SARS-CoV-2. The concept, the fact that it's an RNA virus versus a DNA virus is not going to change. Now, we may have variants and all this. That's not going to change. So that's what I present, and the implications of that. Here's another one. I talk about the mix between transmissibility and fatality or mortality, or in other words, the pathogenicity and the transmissibility. Now, there are many factors involved, but I kind of separate those out. And generally, if you look at a map, or landscape, I should say, of all pathogens, generally, if you're more transmissible, you're less lethal or less pathogenic. More pathogenic, less transmissible. There's a kind of inverse relationship. It's not a mathematical equation, but it's roughly speaking. And what that means is that generally speaking, over time, pathogens tend to become more transmissible and less pathogenic. We may be seeing that already with COVID. Now, I don't want to make this as a hard prediction like I did with RNA, as I mentioned earlier, but I predict that this will become more transmissible and less pathogenic with time. But I also predict, given the situation, my kind of framework of medicine that I have, that it will not go away. And what that means, it goes back to the beginning of our discussion about lifestyle medicine or wellness. That means that people who do have these risk factors will have acute risk. You may die in 2 weeks if you're morbidly obese. In other words, if you get COVID, etc., which is going to be endemic, as I described. So I think that this pressure to move towards the wellness, to move toward the lifestyle medicine, will continue, not just general trends like we've been seeing, but specifically related to this COVID situation.
And so, which entity in healthcare at large scale level have you heard demanding that? Like you
The
mentioned Anthony
education thing?
Fauci. So yeah, yeah. So like which institution that has enough muscle in terms of policy and power to address the population and say, like Surgeon Generals in the US,
Yeah, so
the equivalent in Canada has come out and said, right, so obesity was a big problem. It remains a big problem. We need to move into lifestyle behavior. You need to look after your nutrition. You need to look after your mobility. Sleep is a big one. And we haven't even begun to talk about mental health
yes,
after
sir.
2 years of a pandemic. So where is that coming? I haven't heard anything.
Yeah, so yes, to be fair, there are the anti-Faucis and the public health ministers, and in Korea we had very reasonably good job of this, of communication, of education. But what's fascinating about this is that education is similarly structured like the acute care system that I told you about at the beginning, the difference between wellness and acute care. What do I mean by that? Well, we're getting that education, whether we listen or not, etc., but we're getting that education now acutely because we have a crisis. It's just the same as, you don't take care of your wellness, and then you show up at the hospital and suddenly everyone's around you and all the resources are being devoted to save your life at that moment. So the education that we're getting, which is substantial, we're hearing the government reports and all this all the time, and some people say there's some fatigue related to that, but the education is acutely constructed. So it's all there. But what I'm saying is, where is the sort of background education? Just like wellness should be background care. Shouldn't be in your face every day. I mean, people have jobs to do. They shouldn't be sitting learning medicine. That's what medical students should do. But in junior high school, in high school, even in elementary school, as a kind of backdrop, maybe even, medical shows. Obviously, there are some where the Hollywood gets involved. There are very sophisticated ways that this can be manifested. I don't really see that happening, and I don't think there's a organized legislation or anything like that. I mean, for example, in America, 20 years ago, we had No Child Left Behind. There was controversial education law. There was testing. Let's improve the math skills, reading, whatever. Nobody said anything about health education, right? So I don't see that systematically at all. So I don't want to be critical and say there's no education. There's clearly a lot of education, but it's all acutely framed, and that's fine. But we need to talk about this background education, and I don't see anything being done, except, as I mentioned, I'm doing this mini MD, and I'm hoping ultimately we can transform it.
Another question that comes to mind then is what has been, in my view, there's been a deafening silence of technology firms that are related to wellness during this pandemic. So, in other words, you have big players out there, you have fitness players, whether Fitbit, which is owned by Google, you have all the Garmin of the world, these guys that were in the field looking, as you said at the beginning, to track. So, they had data. They could have jumped in and said, hey, things matter. We're going to collaborate with doctors and we're going to try to improve with you metabolic knowledge, metabolic health management. We're going to try to do something. All I've heard is kind of deafening silence, like business as usual. We sell device. Here is your data. Do something with it or not. So what's your view on the role of technology now in the past couple of years, considering especially the wearables, right? The medical devices, the glucose monitor, the things that are cheap, accessible, and they were sold as, oh, this will change your life. This will help you to change your life.
Well, I think there are two factors. One is I think people were thinking that COVID would go away, and so we go back to the normal. And to be fair, even though I believe from the very early on that it would probably be endemic, to be fair, there was some reason to believe that it would go away because we had other two coronaviruses, SARS-CoV-1 as well as MERS, which effectively went away. And the hope was perhaps SARS-CoV-2 would be like that. But again, that didn't play out. So I think people just thought, well, we just ride this out and then we go back to business as usual. The second thing, which is related to this first concept, is I don't see a lot of people making this connection that I pointed out between wellness or lifestyle conditions such as obesity and heart disease becoming acute risk factors. Now, I think people realize that. But I don't think they see necessarily the implications of that for challenging the way healthcare is structured and where these wearables, et cetera, can play a role in that. I have talked to several startups that have been involved in this space, and I have told them or shared with them this concept that their quote-unquote wellness device has a real role in acute healthcare, in that kind of transition or preventing that transition and so forth. So I've given some advice and so forth, but I don't think, to your point, that the whole industry has recognized this opportunity. I don't put that in a crass way, this sort of change, I should say, paradigm shift of the implications of endemic COVID for upending the medical system. The other interesting thing about COVID, for that matter, is in my mini-MD course, which I've updated a lot, obviously, regularly, but I've updated a lot with COVID, is that COVID affects many things around the body. So we do know that there is a extrapulmonary phase to the virus, and what I mean by that is not just in the lungs, but the virus does get to other places, specifically blood vessels and so forth, gives rise to the clotting, and etc. So it goes around the whole body. This is in distinction to flu, which the virus is basically still in the lungs. Now, you can die from the flu, much less frequently than COVID, of course, but that's more like the whole body has a response, and the virus is not going all around, but COVID goes all around. So I have sections in cardiology, I have sections in neurology, I have sections in immunology, etc., in hematology. All these COVID slides spread all around. So I think COVID is a terrible thing. It's created a lot of tragedies, obviously, but I think that if we take this as a mechanism to really change how medicine is delivered, I think that will be good for the system to accelerate that change, which has, in a sense, the vulnerability being exposed by the disease.
So let's do a thought experiment, which I think are always super useful, and put you in charge. You can choose your country. Put you in charge of not just medical education, but this medical gap that you are
Yes.
wanting to fill. What would it look like, in your opinion, to set this up at scale for that country for it to work, for it to do the job of setting up a new transition into kind of distributed healthcare responsibility between the
Yes.
patient, the healthcare system, and the physician?
Yeah. So first of all, I think let me just address this big picture. Thanks for this opportunity. I haven't thought of it this way, so I appreciate that. But you mentioned about healthcare responsibility. So part of the wellness regime or lifestyle medicine, this wellness world, is bringing responsibility to the patient, to the people. But that's very cruel. It's almost like, you have a job if you have responsibility but no knowledge to do it. And then, so I think that's the missing link. We want to bring the responsibility, and that's good. And people should make decisions, not just to save the system money, but because that's the right thing to do, and human dignity and very fundamental ethics and so on and so forth. But if people don't have the knowledge, I mean, that's almost cruel. So I'm just reiterating what we said earlier, but I think the reason I'm saying this is this becomes really important. We're not just telling people they should learn health because it's nice or it's cool or interesting or because we tell you to, but because it would be unethical to give this responsibility without the tools. So I think that's a real imperative. And so I think when I was in medical school, we took an exam called the MCAT, the Medical College Admissions Test. It tests biology, chemistry, physics, the sciences, mathematics. But there was also an essay. And there was an essay question in a medical school admissions test. I thought that was interesting even many years ago. And I enjoyed that. And I wrote my answer, and I wrote about changing medicine and reforming medicine. I said the most powerful way to do that is through education. That was my essay. I still remember. So I think we need to to answer your thought question, at the level of education, each country is different, but some sort of mandate for, although starting from elementary school on, that there be health education. And there should be materials prepared for that. So just as kids are supposed to learn math and scientific reasoning, and people talk about critical thinking skills, all that, health education should be a part of that from the very beginning. Now, when I was in school, we had health education. Some of it was about drugs, so kids don't do the drugs, so that's important. Some of it was I remember we had sex education class, so teenagers don't get pregnant, etc. So that's important too. But I'm talking more broadly. How does the body work, and how how do doctors? How does the healthcare system work? Why do you go to a doctor? Things like that. Very basic concepts of biology and so forth. And that should be built in as a important part of education, just as much as arithmetic and reading. Excuse me, I apologize. I'm reminded of the Sputnik moment in the United States. That was in 1957, I believe. And then based on that, the United States said, well, we have a problem with science education. And everybody got mobilized. People wrote textbooks, there were programs and so forth. Even Richard Feynman, the famous physicist, Nobel Prize physicist, did a whole lecture series, very famous Feynman lectures, which are still studied today, that resulted from that Sputnik moment. And people often talk about, okay, well, now we have a Sputnik moment, whatever. And I think it's become a cliche, so I don't want to say we have another Sputnik moment relative to health education around the world. But I think it's a relevant example of how you mobilize around, well, we need more science education. And so some people wrote textbooks, some people lectured, some people, restructured the curriculums, whatever it may be. We need something similar to that relates to global, general health education. If that doesn't happen, then we're going to have a lot of suffering. As I said, knowledge is power, knowledge is comfort, and the flip side of that is suffering. If we don't do that, we will have other pandemics that will knock us off our feet. And if we don't do that, then whatever Silicon Valley puts out there with fancy gadget is going to fail. And if I'm a venture capitalist and I want to invest in something that's going to fail, then I'm not a good venture capitalist. So I don't care if you're Elon Musk or, genius venture capitalist and you're investing in some gadgets and you don't have the fundamental educational framework to support that responsibility, to support that democratization, then it's just foolish. You're just wasting your money. So I think it's also about money too, and return on investment, to put it crassly. So all the way from suffering, preventing suffering, to saving money and increasing return on investment, I think we need to have that education, health education for people.
And as adjacent to this conversation or this topic, so what are your views on social media and the amplifier of distribution of quote unquote information that technology is allowing? So it's different side of technology than wearable devices. I'm talking about basically Twitter, Facebook, whatnot. Is there an ecosystem out there that is this distribution of information vehicle that can reach tons of people for not very much money at all, and can be managed and can reach tons and tons of people that you can see would do that job?
I see.
And if so, are you hopeful that it could be benign? In other words, that it would not be used as a manipulation of crowd in terms of knowledge dependency and what knowledge I expose to you, etc.
Yeah, so social media is very important. And I think social media, to be fair to the Twitters and Facebooks, has been manipulated for misinformation. And I don't think it's entirely their fault. Maybe I'm a little controversial here. Why isn't it entirely their fault? Well, if you have a population that's, ignorant of basic science and all that, it can be manipulated regardless. I mean, it can be manipulated by Twitter, it can be manipulated by Facebook. It's like power fills a vacuum, as they say. So misinformation fills a vacuum of knowledge. It's just going to happen. That's not to exonerate Facebook and Twitter and all that, but it just means that I don't think they're responsible for it. What's responsible for it is a lack of the education out there. So then that begs the question, can social media fix that? I tend to be a little bit of a traditionalist. Pardon me if I'm not, chic in the sense of, all these digital devices. But I do think that, traditional education, in other words, young kids in the classroom or online, whatever it may be, in their regular curriculum is important. So if you don't have the regular curriculum, whether it be elementary school, junior high school, I don't think filling it in with some social media on the side is going to fix it. In other words, I think that what I'm talking about with this health education needs to be done in a formal setting. It may be supported informally, with movies, Hollywood, entertainment, but that shouldn't be the central thing. The central thing needs to be established programs in schools, part of the curriculum, that kids are learning about health. I don't think, Bill Gates throwing a lot of money to Facebook or who knows what, or Mark Zuckerberg, and saying, well, we're going to have an education program on Facebook so we can counter the misinformation. I don't think that's going to solve it. It has to be traditionally, at the basic level of all the kids in education. Now, you might call that indoctrination, but, we all have to do reading and writing and arithmetic, and so health should be part of that. Just to survive in society. It's not indoctrination, it's just basic education.
Are you hopeful that in terms of scale, so we're talking, you said in your view, you believe that the social media or the Googles of the world No, this is not their fault if people are manipulated.
Well, I was kind of, I didn't, they might be a little bit fault, yeah, but I'm just saying that if just blaming them is not going to solve the problem.
Sure,
That's my point.
absolutely. But I think they have played a significant
That's
role
right.
in this
But just,
in the algorithms ranking and the decision
but
of
as I
what
said,
information gets.
it's the lack of education that makes that possible.
Sure, sure, absolutely. And here comes another question
Yeah.
then. Is that since they're already there and they're massive, whether you look at Google, you look at Twitter, and Facebook, at least for the West, I mean, China and Asia, maybe you can speak a little bit about Korea, but South Korea. But it's clear that in the likes of China, which has its own internal structure of social media and therefore controls what's in there, and the West, which declares it doesn't really control, but it looks like some way, somehow, technology allows algorithms to do some sort of ranking and filtering. So, given the size of these things, they're not going to disappear, vanishing over time. What could compete with that in a reasonable fashion with the general public and have credential that are autonomous, independent from those filtering things, and therefore that the public has some level of trust. So trust is a big one for health and for
That's
healthcare.
right.
You trust your doctor, you trust science. In fact, I think Anthony Fauci said something rather shocking that if you don't trust him, you don't trust science, or a version of that. So how do we imagine that there would be a competing technology or otherwise social media or format where trust is there and cannot be captured?
Well, I said earlier that I'm a traditionalist, where I think this needs to be done in the schools. And let me explain a little bit more detail what I mean by that. So you have, roughly speaking, just like we said, wellness and medical divide. Roughly speaking, we have a divide between the public sphere and the private sphere. By public, I mean regulated, mandated schooling, typically by governments, and so forth. By private, I mean, people just communicating, free speech. Some countries don't have free speech, but it's private. It's not regulated. It's not mandated. People don't. They may have some censorship, whatever. There may be some algorithms, but it's basically private. So the problem is Google, Facebook, all that are in the private domain. They have a lot of influence, but you're not required to go on Facebook. I mean, they may have algorithms and dopamine modulation tricks to make you want to go on Facebook, but no one's requiring you to go on Facebook. So if Facebook does a massive health education program, why should people be there and to mandate it? And because they're in the private, and this is part of the trick, is Mark Zuckerberg said, well, we can't regulate this. We want it to be free speech, and everyone says you're crazy, you're an idiot. And some people say, oh, you're great because you're free speech, and then you can watch beheading videos because of free speech. I mean, so it's a private realm, and you can regulate some extent, not regulate, whatever. You can't say the four-letter words. You can't say the four-letter words, but that's all on the margins. It's marginal regulation. What I'm talking about is in the public realm. You cannot graduate high school without knowing how to add. You can get on Facebook and learn that 2 + 2 = 22. And you can read a lot of blogs and YouTube that tells you that 2 + 2 = 22, and no one's going to bother you about that. But if you go in school and you say 2 + 2 = 22, you're not going to graduate because it's part of this public mandated system. You have to learn that 2 + 2 = 4, right? So I believe that this health education component is not going to be solved in the private realm like I described, even if a lot of money and whatever, everyone gets excited by it, that's fine. It's going to happen in the public realm, in other words, in the mandated schooling. Now, you mentioned about trust. Now, people don't trust their schooling and nobody goes to school. We have bigger problems on our hands, obviously. Forget healthcare. I mean, we got the whole societal structure. But assuming there is a modicum of trust in junior high school and elementary school, parents are still sending their children to school, assuming there's enough social cohesion that we have that trust, then I think, it will work if we put more health education emphasis in the schools. Now, of course, Google and Facebook can play a role and they can help with this, fine, but I would not put my chips in that solution for the reasons I mentioned.
Again, to conclude this conversation, which we could carry on for hours and hours in different directions, I would like to ask you to tell the audience and the people listening, in the car, shower, walking, what is your weird sauce for life that may be very, very troublesome, like in the middle of a pandemic or in general, and leave them with something they can use to make their life more knowledgeable, more controlled from themselves, and more enjoyable and healthy?
Yeah, so I think for me, I said at the outset that my career has been about innovation. That has been a professional interest of mine, of course. But I think innovation is very important for personal, I wouldn't say success, but personal, how should I, peace of mind or dealing with life. And I teach innovation, and I've often told my students, and I'm sure every professor says this class is the most important one that you'll ever take. But I mean that when I talk about innovation, because I was saying this in the midst of the pandemic when I was teaching, and it was clear that the only way we were going to get out of the pandemic was through innovation. Whether it be obvious innovation, like what people think, with a vaccine, mRNA vaccine, whatever, or less obvious innovation like new social measures and how to balance epidemiologic control with economic and mental health and whatnot. So, all of it is innovation. It's not just gadgets and software or whatever. And if you look at the history of humanity, we solve problems as a society and individually with innovation. And then, I've been teaching this in the middle of COVID, and we see with the variants, the virus is also innovating. So we're fighting innovation with innovation. So I think if there's a take-home weird sauce, if I understand what you're implying, I would say to be innovative and to be always thinking innovative. So there's another project that I'm involved in, which is developing a theory of innovation, which we can do for another discussion. But I've been trying to isolate or identify what are the key elements of innovation. And I think that having that innovative mindset has been important for me personally. Often people say, "Oh, I want to be young," or "I want to think young." Well, thinking for the future, thinking how to improve things, thinking differently, thinking out of the box, which is all elements of innovation, is in a way achieving a certain kind of youth or young, always thinking young, not to be vain about it, but, thinking in that way, and not that youth is better than being old necessarily, but I think you know what I mean. And I think if we're talking about the meaning of life and what people want to accomplish, achieving a kind of immortality through their children or through their accomplishments, if we do something innovative and have a positive impact on society, that's also a kind of immortality, if you will, relatively speaking. So people talk about feeling young and keeping healthy. People talk about making an impact and living, beyond even after they die, whatever, immortality, whatever you want to call it. I think if I would put it all together, I think innovation is the weird sauce, for me at least.
Dr. Ogan, Gurel, thank you very much for this very insightful conversation. And I hope we have the pleasure of revisiting that in different connotation and subjects, as you obviously have a breadth of knowledge in many. So thank you again, and be well.
Yeah, thank you. Take care. Thanks, Florence. Always a pleasure.
If this conversation stopped you in your track, share it with your network. You never know whose life you might change for the better. Thank you for listening. Stay curious about our next guest and stay curious about life.